Thank you for meeting with me, sir. I really appreciate it. Our current Medicaid program just is not sustainable. Nearly 1/3 of Kentucky's entire population is enrolled in Medicaid, and 19% live in poverty. Sir, we rank 47th in the nation for median household income. 1 out of 3 Kentuckians are obese, and we rank second highest in the nation for smoking and first highest in the nation for cancer deaths and preventable hospitalizations. Our unemployment rate is close to 6%, and our workforce participation rate and wages are among the worst in the nation. When we expanded our Medicaid program in 2014 to include all newly eligible adults with income below 138% of the federal poverty level, we placed able-bodied working-age adults into a program that was designed to support disabled individuals, pregnant women, children, and other vulnerable populations. Sir, our enrollment increased 68% between December 2013, which was just prior to the expansion, and April 2016, and we have seen zero impact on the health status of Kentuckians. We also didn't include a long-term financing plan. We barely have covered half of the administrative costs of the expansion and none of the costs associated with the benefits we provide. This year, we have to start paying a portion of the actual cost of the expansion. That'll equal about $1.2 billion between 2017 and 2021. Hey, let's implement a Section 1115 waiver. It'll give us a way to demonstrate a different approach to Medicaid. We can be much more flexible in how we operate, and we can move away from federal program rules and current laws that govern Medicaid and CHIP. But we'll have to meet CMS requirements to maintain budget neutrality, transparency, and evaluation.
Wait, what does that mean?
Budget neutrality means that federal costs under a waiver must not exceed what federal costs would have been for that state without the waiver as calculated by the administration. The federal government enforces budget neutrality by establishing a cap on federal funds under the waiver, putting the state at risk for any costs beyond the cap. The Secretary of the Department of Health and Human Services, or HHS, requires public notice and comment periods prior to CMS approval. We will also have a publicly available approved evaluation strategy and submit annual reports describing our waiver changes and their impact on access, quality, and outcomes.
Oh, okay. Tell me more. Are there other states doing this?
Here, take a look at this chart. As of February 2017, 33 states had 41 approved Section 1115 waivers. There are 5 categories of waivers: delivery system reform, alternative ACA Medicaid expansion models, long-term services and support, behavioral health, and other targeted waivers.
Which one are we going to do?
Here, take a look at the themes in the other 7 states. We want to be the 8th state to implement an ACA expansion waiver. Indiana's waiver is an interesting model, but it has some known deficiencies, so we're going to want to use their lessons learned to make Kentucky's waiver better.
That sounds great. Tell me more about what you're thinking, and we can take it to Governor Bevin.
I came up with this great plan, and over the 5 years of the demonstration, it will save taxpayers $2.21 billion. I want to call it Kentucky Health, where health is an acronym for helping to engage and achieve long-term health. Catchy, isn't it? Here's what I'm thinking. We will include the adult expansion population and all other non-disabled adult Medicaid beneficiaries and allow CHIP-eligible children to enroll in the same health plan as their parents. Through this program, we can introduce commercial health plan concepts, educate our members, and incent healthy behaviors. Within Kentucky Health, we will have an alternative benefit plan, or ABP, where there will be 2 variations, a co-pay plan and a premium plan. Members will be required to pay premiums on a sliding scale from $1 to $15 each month in lieu of co-payments. All able-bodied working-age members will be required to complete 20 hours of community engagement each week as an additional condition of eligibility. This can include volunteer work, employment, job search, job training, education, or caring for a non-dependent relative or a person with a disabling chronic condition. We will also have a $1,000 deductible account and send a monthly statement as a teaching tool to show members how much their health services cost and how those services deplete that $1,000. In a commercial health plan, the member would be responsible to pay that money out of pocket, but in Kentucky Health, the Commonwealth will contribute the $1,000. Ultimately, our goal is to educate our members about commercial healthcare plans, get them engaged in their own healthcare, and eventually have them move off of Medicaid and back into the workforce. Kentucky's 1115 demonstration waiver was submitted to HHS Secretary Sylvia Burwell on August 24, 2016. Recent proposed changes have been submitted to the application, and public hearings are being held on July 14th and July 17th. Once CMS approves the waiver application, Kentucky requests implementation within 6 months. Medicaid members who will be moved into the Kentucky Health Program will be notified December 16, 2017, and will be moved fully into the program starting July 1, 2018.